The US healthcare system is in a very precarious situation right now, and we've got to decide, how are we going to make this shift? How is it affecting you, and what can we do about it? And that's what we're going to talk about on today's video. I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with over 5,000 people, helping them optimize their brain function, their body function, and then supply the energy to those areas so that no matter what they're facing, they can ultimately bring their best response to increase the likelihood that they're going to get the outcome that they want. So really, when we look at the healthcare system right now, when we look at the chronic disease epidemic that's facing the U.S., we're in a very precarious situation because we continue to spend more and more money on our healthcare system. Like when we look at the General Motors and different places like that, their health insurance is the biggest cost that they have. Why? Because everything is so expensive right now. We're facing chronic diseases. There are so many people that are sick. Jessica Ho did a research study in 2019, and what she found is if you are on one medication, you're just as likely to be on 5 as you are on 1. And that's scary to think about, right? And there's two ways to look at this. We can say that, if we're on one medication, we've got some sort of chronic illness, and you're more likely to be debilitated, and you're more likely to have problems in other things. And that is an accurate way of looking at things. We can also look at this as, is that one medication causing a decrease in function? And that is exactly what Magaziner, and I can't even pronounce this guy's name, but Nidic, I don't know, it's Gnijidic et al. They both found that same thing, is each medication that somebody goes on, it decreases their function. Now, when we start seeing more and more prescriptions within the same person, that's a bigger problem, right? Because we don't know exactly what side effects each person's going to have, right? You take a medication and you may have one side effect, you may have multiple side effects, you may not have any. We don't know who's going to have what side effects. When we start mixing medications, we have no idea how it's going to affect that. There's not anybody on the planet that knows how all of these different medications mixed together, how they're going to respond to each individual, let alone, it'd be reasonable to expect that we'd have an idea of how they respond to each other. We don't. But within the individual, it's impossible to know, right? That's a research that's never going to be done because it has to be individualized for each person. That's not going to happen. And getting rid of pharmacy is not the answer to this. But when we change the focus from going to a pharmaceutical-centric model, where the pharmaceutical companies are telling us, hey, you know what? We've got an easy solution. You don't have to do anything. Why change your diet? Why start exercise? Why do anything when you could take this one little pill and it's gonna erase that symptom? And it probably is going to change the markers that they're looking at on that. If you're taking a blood pressure medication, you're likely to have lower blood pressure with that. If you have a cholesterol medication, you're likely to have lower cholesterol. But does that change health? And that's a totally different question. 80% of the chronic diseases that we are facing today are lifestyle diseases. Think about that. 80% of the diseases that we face are totally preventable with changes to the way we live our life. And that may be adding exercise. That may be changing how we go about sleep. That may be stress management. It may be, there's a million different ones we could do. It may be not drinking. It may be not smoking. It may be whatever you want to say on that. There's 80% of our diseases are preventable. 80% of them can be addressed with lifestyle changes. Think about that. Now, if you look at somebody with 5 medications, which is the definition of polypharmacy, right? Is if you're taking 5 or more medications, and it's not uncommon for me to have people come in that are on 5, 10, 13, 20 medications at a time. They just hand you a list because they're tired of writing them all out. That's not uncommon. And we don't know how each one of these is impacting them. But what studies show is that each one of them is decreasing their function a little bit and a little bit and a little bit. So when we finally change our approach to where we're recommending lifestyle changes, and that, like I said, a lot of times making changes doesn't come down to just, let's take this away and let's just do this instead. It's, let's start doing some of this and then we can work to take some of this away. Let's start doing some of this over here, then we can take a little bit more away. But as we start compounding that, when we start making exercise changes, as we start making dietary changes, as we start, improving our sleep and managing our stress better, when we take away smoking or drinking or whatever that may be, sugar, it doesn't matter what we're talking about on this. As we start to compound those changes, that's where you start to get healthier and healthier. Instead of getting into this system where we continue to get sicker and sicker and sicker and sicker and cost more and more money, not just to ourselves, to our insurance providers, to our country, to everybody else. And it's a system that's not working, right? We've got to change the model. We've got to change the way that we think about health. And with 80% of our healthcare problems, our chronic problems being lifestyle related, why aren't we addressing that more? When was the last time you went to your doctor and your doctor said, these are the steps that I want you to take? It doesn't happen very often, right? They're like, hey, take this pill. We've got to start, hey, you know what? This right here is a pill that you can take, but you run these risks with it. Instead of taking this pill, why don't you try changing your diet, changing your lifestyle, adding some exercise in? And here's how you can do it. By exercising, go for a 15-minute walk per day. Go do, 10 push-ups a day. Whatever that exercise may be. On your diet, instead of reaching for, all the normal stuff, eat 10 carrots before you reach for dessert. Increase the protein. Instead of, this and this, try this and this. We can make those changes, right? But in most cases, recommendations are take this pill. And at best, it's hey, take this pill and exercise more. Or take this pill and change your diet. Or take this pill and do this. But there's no directive on how to do it, right? What does change your diet mean? If you look it up on the internet, there's 4,000 different diets. We could go endless different directions with that. Is one of them going to work? Maybe, maybe not. What's going to work for you? We've got to do something that is a little bit better, more targeted to that. But when we start making this shift to where lifestyle recommendations are first and foremost ahead of everything else, that's where we're going to start seeing health improve. And that's why I'm so excited about chiropractic care. Chiropractic care is focused on the lifestyle things. How can you move better? How can you eat better? How can you sleep better? How can you de-stress? How can you do all of these things? And when we have that natural approach, front and center, we see better outcomes. Now, like there's tons of studies, and we went over a lot of these in different videos, but there's studies that show when people come to a chiropractor first for pain-related things, they spend less. They don't have as much opioid addiction. They don't have as many surgeries. They don't have any of that. They spend less, and they have better quality outcomes. I can't think of the study that showed that off the top of my head, but one showed that it was pain, and I think it was only like 8 chiropractic visits, something like it was, which sounds like a decent number, right? However, those 8 were developed or were given in 1 month of care. 11 months later, they were compared to a group who had been through medical treatment for this. They'd been whatever the medical doctor wanted to throw at them, whether that be physical therapy, whether it be drug treatment, whether it be over the counter, whatever they wanted to throw at them, nerve ablations, whatever it was. And then they measured. Chiropractor got 1 month to treat, 11 months between the treatment and the actual assessment of that. And chiropractors had 2,700 times the outcome. They had 2,700% greater outcome than the medical side of things. What does that tell you? What that tells me is we've got to focus on lifestyle. We've got to focus on movement. We've got to focus on diet. We've got to focus on these things that are foundational to health. Because when we focus on the foundational side of health, we actually make a change. Until we make that switch, we're destined to repeat the failure over and over and over again. And it's costing us in more ways than just, it's costing us more ways than just our personal finances. It's costing us in insurance. It's costing us in tax money. It's costing us in life lost. I mean, not even just like full lives lost, but like quality of life lost. How much is that worth? More than any of the financial stuff we're spending on it, right? We've got to look at this in a little different way. And when we can actually do that, that's when we're going to start to see these chronic diseases start to come down. We're going to start to see people expressing more vibrancy and more health. And that's ultimately what I want to see. That's ultimately where I want. That's what I want for you. So ask yourself, not only what are you doing? Like, are you on multiple medications? What is your plan? Like, talk to your doctor. And what is the plan long term? Do they have a plan to get you off of any of those? Or are they just, here, you're on this and you're just on it for life? What is the plan to help you, build for the future rather than just continue with where you're at? Because when you settle for the status quo, you're going to get average results at best. When you start expecting more, that's where you start to see real change. So I love you guys. I appreciate you. As always, I know your attention is your most valuable resource, and I appreciate you spending some of that with me. If you know somebody that needs to hear this message, please share it. It helps me understand what type of things I can share with you to help you get where you need to go. But this is a message that we need to get out there. There's so many people that need to hear this, because we, as a society, we're not healthy. We've got to make that change. And until we actually start focusing on the underlying problem, we're not going to do that. So appreciate you, and I'll catch you on next week's video.